Hello friends, this is a video demonstration of uniportal endoscopic interlaminar approach for caudally migrated disc herniation. The patient is a middle-aged lady presenting with low back pain with severe bilateral lower limb pain, weakness in both the lower limbs with perineal numbness and poor urinary control. On SAG MRI, there is L5-S1 large disc herniation with caudal migration, and on axial scans, there is significant sequestrated disc herniation with thecal compression. This patient is taken prone under GA and docking was performed. Here you can see I'm exposing and clearing the tissue from the bony elements. At 3 o'clock is the cranial L5 lamina, which here I am drilling. Caudally would be S1. You can see the interlaminar space with yellow ligamentum flavum. The drill is being performed to enlarge the interlaminar window, and herein we are also drilling part of the inferior articular process so that we can go lateral to the neural elements. The curette is used to separate the ligamentum flavum from L5 lamina, and rongeurs are used to upcut and extend the interlaminar window. Also, part of inferior articular process is cut. Using scissors, the ligamentum flavum is gradually thinned out and cut open from medial to lateral aspect. Here, 6 o'clock is lateral and 12 o'clock is medial. Here, you can very well appreciate that the ligamentum flavum has been excised to expose the neural element. Most probably at this point of time, we think that it is an inflamed root. The Kerrison rongeurs are further utilized to excise part of the superior articular process and expose the traversing root. Hemostasis is achieved lateral to the root, and further caudal extension is done so that we could reach the caudally migrated disc. Here, a piece of sequestrated disc fragment is herniating out, which is being gradually cheesed out, and we found a big fragment being excised at this point. Thereafter, the axilla was clearly seen and there were further disc fragments. The window caudally was extended so that we could see the axilla much more clearly. So here ligament and the part of lower lamina is excised and sequestrated fragments are being excised from the axilla. Here you can appreciate the sequestrated fragments between the axilla and theca. A 90-degree is being used to gradually pull up the sequestrated caudal migrated fragments. So here there is another piece which is being removed, and as we are removing these pieces, the axilla is getting gradually decompressed and clear. Whenever you remove fragments, you will have some bleeding, which can be dealt with radiofrequency. Here, a root retractor is being used to excise part of the L5S1 disc fragment, pushing the traversing S1 root medially. So once internal decompression of free fragments is done, we sort of check for any free fragments at the disc level. This you can appreciate because of 15-degree scope that we can see under the root and theca, and there were no free fragments at this area. Thereafter, we went in and we found some more fragments which were caudally migrated, and they were gently removed. Final confirmation was undertaken so that no free fragments or sequestrated fragments were left behind. This is just to confirm these are certain large fragments which I'm showing after the surgery. The patient did extremely well. Her pain has resolved. There is perineal numbness. You can see the post-op images, which shows a radical excision of these fragments. Thank you.